Our next presentation is from Amanda Fulton with Southern Dental Instruments. They're a first-time exhibitor here at the Hinman meeting.
Good morning, everyone. I want to start off by saying I'm very excited to be here. I am with a new company, Southern Dental Instruments, and we have a new product. It's innovative. You've never heard of it before, so I'm pretty excited about showing you what we have. So I'm just going to kind of jump right in there. So CShape is actually an instrument, and what it is, it's a handle that is specifically designed with silicone tips on the end. What we have now is an instrument that not only works well in restorative dentistry, but we just found out that it actually works great in our surgical aspect as well. So we have a round tip and a flat tip design. The round tip you will utilize significantly with every restorative that restoration that you do. And again, I'm going to ask for a little bit of grace. This is the first time I've done this, so thank you very much. With the round tip design, you're going to condense your material into it, but what this does is it eliminates all of your voids and it expels all of your excess composite material. What we are finding is that it increases our marginal seal. Our goal with this is to take a restoration, our composite restorations that last typically 5 to 7 years. We want to try to make that go from 7 to 10 years. Dr. Brady actually, she bought this from me at UAB, and she just wrote a blog on it that with the round tip design, you do see that increase in that marginal seal. The flat tip is designed for your anterior restorations. You can take an MDLF on your number 8 and you're able to just use the tooth structure and just create that. The handle does have an undercut on it that's going to help keep the tip in place as well as help prevent you from punching through it. It is silicone, so you can do that. So this right here is just going to show a quick video of how it'll work in the occlusal setting. What you're going to see is as you condense the material into the restoration, you increase that marginal seal. You'll see all of that excess composite come out. What's most important is that it comes out under pressure. And real quickly, the reason that we call it CShape it is what you want to do is we're trying to create a verb. Instead of, when you ask for your acorn, the idea is you just CShape it. So as you condense down in there, you run it along the natural contour of that tooth. As you're doing that, you're increasing that marginal seal. How you could burnish your amalgams, you can now burnish your composite restorations. So, and also most importantly, you do it with efficiency and just the time that it takes. You have minimal to no occlusal adjustment that needs to be done. So I find when I go into a lot of these offices that they'll say, I've been an assistant for almost 12 years, and so I know how long you will sit there and it's just like, is that bite just gonna get right? But this, it contours naturally to the tooth, so then you don't have to worry about that. So when I say the surgical aspect of it, we do bone grafts and membranes in our practice. So what we always find is that the bone will kind of stick, and if you pull, you're flat or whatever, and it's going to start on its own. So there you go. We'll just watch it.
It's just a silicone tip.
So we were very, extremely excited when we realized that this worked in surgical dentistry, because we all know that that membrane is so tedious, at least for us in our practice, getting that membrane to stay right where you pull that periosteal elevator away, and then there you go. There goes your membrane, and you got to redo everything you just did. With the CShape system, it does not stick at all. Where you tuck that membrane in, it stays. So that for us was a really big deal, and it has been. Dr. Ferguson is actually we've been talking about it. Some of the advancements that I'll just kind of tell you are the exciting things. It's actually being tested with Gordon Christensen right now, and so hopefully we will find out, we'll find out in April what our grade is going to be with that, but I have no doubt that it will be significant. Radiographically, with your restorative dentistry, you have a more opaque restoration. You're actually packing more composite into that. So that is one thing that there is a case study on our website that you can actually go to and you can see with that. So some of our frequently asked questions, I understand that this is something that is kind of mind-blowing, and it's game-changing for your practice, but it's also a change of your thought process, because I'll just go ahead. The elephant in the room is the C factor. So yes, you can layer if you need to layer. The tips themselves, they do only come in one size right now, but that isn't something that we won't necessarily change in the future. So with the tips, though, I will say we have 2 pediatric offices that have completely equipped their offices since switching to the CShape system. Because of the efficiency of placement, you can cover that entire restoration and expel all of that excess composite material out. Why is that so important? As you expel that excess composite material out, it's being expelled under pressure, so there is nowhere else for that composite material to go but out. So that for us was a really big deal. The tips are disposable, so no, you do not reuse the tips. The reason for that is it's silicone, so you don't want, especially if you're doing like an MOD and if you're using the Garrison system or if you're using the traditional Toffemeyer system, if you get a little cut in that silicone that you can't see, you don't want to transfer from one patient to the other. So, and also in that same detail, we don't recommend that you use cold sterile. I know dentists, so I'm sure it'll get done, but we do not recommend it. If you do layer your composites, as far as with the C factor, you can actually get into there. So whether you layer, because it is silicone, it adapts to whatever surface you put it to. So if you have a wall that you want to attach it to, you can push in on that wall. If you want to get down to the base, you can get down to the base. We have several models and several ones that you can practice with at our booth. So you can come and practice it for yourself, and you can see the benefits for yourself. You do not have to use a specific brand of composite. It has been used from sticky to the super hard. We've gone through several different ones. No composite has stick to it. If you are doing an anterior restoration, it does make it easier if you dip back into your bond or if you dip back into alcohol, just to help smooth it across. So, but you don't have to. It won't stick to anything. And another wonderful aspect of this, I went into one office and the hygienist got it. They're like telling their doctor, it was Dr. James, he's telling him, no, you cannot use this. This is for us. You cannot take our instrument. Because when it comes to sealants, whether you're using a micro brush, an Explorer, a cotton tip applicator, you get a pullback. I've placed sealants, hygienists place sealants, you get that pullback. With the CShape system, you do not get a pullback. You glide it right across that tooth surface, and it's something that your doctor, as an assistant or a hygienist in Georgia, your doctor won't have to adjust your occlusion away. So it's that sealant that you can feel but not see, and you don't get that flaking that happens after. So you get those patients that come in, you've got part of a sealant and you got a giant occlusal underneath it. It's because that sealant flaked off, and you don't get that with this system. And in a surgical setting, yes, you do need to sterilize the tips. You can pre-sterilize them, but not post-sterilize them. So the way that we do it within our practice is we put a round and a flat tip together. When we pull everything else, we just pull that with it. So that's it. Do I have any questions? Booth number is 709. We would love for you guys to come out. I have several videos. A big question that I get are those class 2s. Please come test it. I encourage everybody to try it. You can try it on the model. I have several more videos that you can see. So, and we do have a special going. So it is something that's also extremely sustainable for your practice. It's not something that's going to break the bank. I hear, well, I don't want to have something that I have to replace. No. What we find in our practice is we save on average 20% in our composite bill. Because you can place these restorations so quickly and with efficiency and not have to do that adjustment after, you utilize your chair time. So what we have actually done is we've shortened our blocks to 45 minutes. So either you can shorten it and your doctor can go, have his coffee, or you can just pull with ease from your schedule. So your hygienist, they see you got an occlusal over here, so you just pull it on over, and you're able to do that just so quickly. So you increase your production in your practice while decreasing your composite bill. Any other questions? Yes. No, it is through direct, but I do have it here, so you can take it home with you and try it in your practice on Monday. Yes, sir.
How about using something like P-TAC build last side?
Yeah, you can. I'm sorry? No, it doesn't stick to anything. That is the beauty of this, and the reason you can just run it along that tooth. And I have my hand motions, but as you just run it across, literally it increases that seal. We are also currently getting it tested with the University of Tennessee. They're going to do a cross-dye section testing on it, so we're pretty excited about that. So it's innovative. It's game-changing for your practice in all aspects of it. Any other questions? Okay. Thank you so much for giving me grace during this. You guys have a great day.